today we have a seminar on functional food and COVID updates, and we have an excellent presenter, Dr. Elihud Salzar from Mexico. She is becoming one of our certified functional food scientists, and she done excellent work, and I saw some work already what she done. So next 40 minutes we're gonna have her presentation, and we can prepare some question if we have. So Dr. Salazar, please share your screen and then start presenting. Thank you.
Okay, thank you. I am very glad to present this because this is something that I've been thinking about. Well, since March 11, 2020, that the World Health Organization declared the COVID-19 pandemic, it's been a long journey. And what we know now about that? We know that there are more than 500 million people infected. There are more than 6 million people dead. And now we know that the SARS-CoV-2 virus evolves to different strains. What we know now that there are a lot of symptoms. So people are affected in different ways, depending on the strain, depending on the environment, depending on different things. We have from common symptoms that include fever, cough, loss of taste or smell in some strains or not, and serious symptoms like people with losing their sense of smell, that people that are dying. But we all know that it is depending on a lot of variables in these people. We still don't know how to prevent or treat it. We know what we can use to protect masks. We can use the washing, cover, avoiding close contact, but the best protection is vaccination. But until sufficient vaccines are supplied, we should go to the alternative therapeutic options as functional foods and diet to mitigate the spread and severity of COVID-19. What we know now that functional foods can help in preventing and making the symptoms less worse by modulating the host immune system, by generating antiviral activities within the host, and synthesizing biologically active agents effective against COVID-19. This is a very nice graph reproduced from Franzana and colleagues' work that show the potential mechanisms through functional foods can treat COVID-19. We know that foods can increase the level of immune cells, reduce the release of inflammatory cytokines, reduce the expression of ACE2 receptors, and inhibit the protease and structural proteins in SARS-CoV-2. I am going to make a review of some of the different nutraceuticals, supplements, and foods that have a role in preventing the COVID-19. I'm going to start with vitamin D. We all know that vitamin D has a proven role in many infection disease of the respiratory tracts, and it will also play a role in SARS-CoV-2 infection. Here I show a table that appeared in this paper on the Frontiers in Pharmacology that shows the results that using vitamin D in different doses, there was a reduction in inflammatory markers. There was a reduction in the time of recovery of gut and gustatory sensory. There was an improvement in oxygenation among patients treated with calcitol, and there was less often stayed in the intensive care unit. What we know now about vitamin D, that the deficiency may increase the risk of COVID-19 infection and the likelihood of severe disease. So we have to correct the concentration value to give a normal concentration or recommended concentration that is 30 nanograms per milligram. And here is a little table that shows that adult patients, we should double the recommended daily intake of vitamin D, also for seniors. And this is a very interesting recommendation for people working at night. So it's so we have to increase the doses of vitamin D, especially in people that are subjected to be in touch with people with positive COVID-19. We're going now to see the vitamin C. The association of vitamin C deficiency with pneumonia and immunomodulatory effects is well known, is very well documented. Vitamin C, there are a big number of trials done with vitamin D with different findings. We have different types of different size of populations and different type of cohorts. And there are many that found that vitamin C was low in people that were critically ill with COVID-19. This is another number of studies that show this, again, that the different results. Here is one that shows the concentration of inflammatory markers decreased after the intravenous vitamin C treatment. We have another group of trials that showed that here Kumari vitamin C can significantly improve clinical symptoms and reduce days spent in hospitalization. And we have here two other trials that show that the treatments did not significantly improve outcomes in the group who were treated with intravenous vitamin C. And the other one here, that the treatments did not significantly decrease the duration of symptoms, number of hospitalizations of death. So we have a very heterogeneous results, and a meta-analysis made by Rawat and Collett showed that the administration of vitamin C did not have any effect on major health outcomes in COVID patients in comparison to those in placebo or standard therapy. They made a subgroup analysis that revealed, irrespective of its dosage, route of administration, and disease severity, it didn't have a discernible benefit in patients with COVID-19. But still, it has been proven that it has some benefit in diseases of the respiratory tract. So we have to encourage patients to eat more fruit and vegetables to get the recommended daily intakes, especially from foods high in vitamin C, like the ones that show in the table. What do we know about zinc? We know that zinc has a possible role of the anti-inflammatory as an anti-inflammatory activity to the inflammatory response of COVID-19. There are some interesting trials also, and we have the main results are that using a supplementation with zinc, there was a decrease in the length of hospitalization, a decreased duration of ventilation, a decreased ICU duration. Again, in this one, this showed the same decrease in hospitalization and ventilation. And again, in this last study of Abd El Salam et al., they show the same results. What do we know about zinc? Well, we know that zinc is being considered as a prophylactic or adjunct therapy for COVID-19 with a lot of clinical trials going underway. Zinc has now been shown that it has properties in modulating the competitive balance between the host and pathogens. It has antiviral activity, and the mineral plays a central role in regulating brain function that many disorders have been associated with zinc deficiency, especially some like the loss of taste in people with COVID-19. We have then also to encourage people that with suspected or that has been near people with COVID to increase their intake of zinc to get their recommended daily intake using the foods that are in the table. Another of the minerals that have been under study is the selenium. We now know that selenium and selenium protein species have an active role in innate and adaptive immunity, reinforcing selenium as a nutritional tool to counteract viral infections. There are a lot of trials going right now, and what they found, most of them, is that selenium level is low in patients with COVID-19. Here are some other of the cohorts and going right now. Some of them show the levels of selenium low in urine, and some are made in blood. And some find no difference, so we have also different results in these trials. What we know today about selenium, as Fakhrul Moshbari et al. Say that COVID-19 have decreased level of selenium and its association with severity and mortality of disease may suggest that we can use selenium as a supplement. But there's also a caution, because there is a very narrow range between what's appropriate and what's the toxic amount of selenium. So selenium supplementation at an appropriate dose may act as a supportive therapy in COVID-19, but we shall continue to do more research. And we can also encourage our patients or people to eat foods high in selenium to get their recommended daily intake. That is 60 nanograms per day for women and 70 for men. We're going to start reviewing some of the herbs that have been studied during this period. I'm going to start with licorice. We know their major bioactive components. The properties are anti-inflammatory, and their role in fighting COVID, it could be that glycyrrhizin inhibits the 11-BHSD2 enzyme, which degrades cortisol to increase aldosterone level. And we have also the Boswellia serrata with these three major active biocomponents that has antiviral, anti-inflammatory, antibacterial, and antioxidant properties. This has a direct action with IKB kinases that inhibits the nuclear factor KB-regulated gene expression. That BA not only inhibits the formation of classical 5-lipoxygenase products, but can also switch from the production of pro-inflammatory leukotrienes to a formation of anti-inflammatory selective modulators. I found these two very interesting papers, one made in vitro by Van de Sant and colleagues, that demonstrate that glycyrrhizin, the primary active ingredient in licorice root, blocks SARS-CoV-2 replication by inhibiting the viral main protease. So they proposed that that antiviral compound should be further investigated for the treatment of COVID-19. And then we have another paper that's using glycerin and boswellic acid for hospitalizing patients with moderate COVID infection. This study showed that the combination of GR and BE is unique for COVID-19 because it's because of its multi-target action. It has been found to be effective in preventing mortality, shortening the time of recovery, and improving prognosis. And they show a significant difference between placebo group and intervention group in serum CPR and percentile of lymphocytes. Okay, we're going to look at garlic. Garlic, we know it has a number of major active components, bioactive components. We know that about its anti-inflammatory and antimicrobial properties, and the role in fighting COVID-19 is that it may inhibit the M-Pro protease of SARS-CoV-2. The garlic will increase the number of Treg cells, cytotoxic and helper T cells, and NK cells, which all are reduced during COVID-19 infection. And it can help reduce the leptin levels, which improve appetite loss in COVID-19 patients. But as said at the Cooper in this trial said that garlic's effectiveness against COVID has not yet been proven, but it could be a possible option for the management of COVID-19 because of its ability to modulate the cytokine secretion, the hemoglobin production, the phagocytosis, and macrophage activation. When we can use garlic as a part of the diet, because we know that it had no side effects and it can be used in different types of foods. We go to look at turmeric, the curcumin, the role of fighting COVID-19. It mediates the anti-inflammatory responses against different cytokines. Curcumin may attenuate cytokine storm that prevent COVID-19 severity and reduce the necrosis factor. Also prevents prevents pulmonary edema in COVID-19 lung disorders. This is a very nice work from Damasevi. It's a randomized double-blind placebo work. It worked with 30 mild COVID patients, 40 severe COVID patients, and 40 controls. They used nanocorcubin in 20, placebo 20, and they gave them 20 milligrams of curcumin 2 times daily during 21 days. The mortality rate was significantly higher in the placebo-treated group compared to the nanocorcubin-treated group in both group of patients with COVID. So we can say that curcumin could serve as an adjuvant drug in COVID-19 treatment, and is a well-tolerated natural compound in humans, even at high concentrations. We move to neem, that has a big number of major bioactive components. Again, it has anti-inflammatory, antimicrobial, antioxidative properties. And this has acetylhedinogedunin alongside with other components have been shown in molecular docking studies to inhibit papain-like protease of SARS-CoV-2, which may reduce their viral spread. This is another very nice work about neem, another prospective randomized double-blind placebo with 190 healthcare workers at the hospital or relatives of people that has patients with COVID-19. The participants were received 50 milligrams of a patent pending neem leaf extract orally in cat soup twice a day for 28 days. Of the 154 participants who completed the study, 11 test positive, 3 in the intervention group, and 8 in the control group. So it shows that people that are near people with COVID are less, they get less contagious with it taking these neem capsules. So neem capsules demonstrate its potential as a prophylactic treatment. We move to Camellia sinensis. We know it has many bioactive components, again, anti-inflammatory, antioxidative, and the studies that have been made with EGJ-CJ that inhibits protease and structural proteins better than conventional drugs in this disease. Here is this is the study from 2029 that shows that green tea polyphenols provide antiviral activity in various forms. The most important catechin, EGCG, is viewed as a potential treatment agent for SARS-CoV-2 infection. But we need more animal and clinical testing to validate these results. On May 2020, they start looking at the microbiome. And I found this work from Professor and Dr. Kalantar Sadeh The name considering the effects on microbiome and diet on SARS-CoV-2 infection. And the abstract that they published in that moment said that the need to investigate the possible impact and therapeutic options for COVID-19 based on dietary and microbiome modifications. They also proposed the use of nanotechnology to impact the virus. We have to look that the dysbiosis of the human gut is associated with various health conditions, including respiratory and the gut. So the gut-lung axis is being explored and shows the way that dysbiosis that occurs in the gut precipitates the cytokine storm and cause multi-organ dysfunction. And that is why we see people with severe cases of SARS-CoV-2. The leaky gut leads to bacterial products and toxins that goes into the circulatory system with more pro-inflammatory cytokines. So this gut-lung axis is the one that is seen as one of the problems in SARS-CoV-2. There is evidence emerging that the degree of dysbiosis correlates with the severity of COVID-19 illness. And here is this very good paper of Professor Gio and colleagues, where they show that the gut microbiome composition of patients with COVID-19, patients discharged after a negative PCR test and non-COVID healthy people are different. So there's a difference, especially in the Firmicutes and the Bacteroides and the Actinobacteria. So we see that people have different microbiome depending on the stage of the disease. This is another very interesting paper of Dr. Suo that found that fecal microbiomes from patients with COVID-19 show a depletion of symbiotes and an enrichment of opportunistic pathogens. Here we see that a reduction in Eubacterium and Faecalibacterium, Roseburia, and Lachnospirae taxa, and the opportunistic pathogens have increased compared to the healthy ones. So this again shows that there's this dysbiosis in the microbiome of people getting COVID-19. That evidence is mounting that the good dysbiosis is predisposing factor for COVID-19. And as the intestine and the lungs are organs that share a big relationship through the gut-lung axis, that they influence immune response and inflammatory process. So the hypothesis is that both may respond to the treatment with pre and probiotics. Here is a work from a group in Italy that they say they put the question, good microbiota status in COVID-19 and unrecognized player. This was published in 2020. And they say that it would be should use probiotics and prebiotics as a safe and inexpensive way to treat the COVID-19 progression and as a preventive strategy for people that is not infected with coronavirus. Again, we show the difference between people with COVID-19 at this dysbiosis and healthy people with eubiosis. What are the potential roles of probiotics in COVID-19? They help modulate the innate and adaptive immunity, modulate the synthesis of immunoglobulins, inhibits various cytokines and chemokines, express several viral defense genes, regulate Th1, Th2, and Treg cells, and they have anti-allergic properties. But here is a sentence from this review article published in 2021. Blindly using conventional probiotics is not warranted until we clearly understand SARS-CoV-2 pathogenesis, its effect on good microbiota, and vice versa. So we still have to do more and more studies. Here are the clinical trials with probiotics that some are now they're working now on them. Some have results. The main results are using different probiotic strains. This one from the Etor, they show significant improvement in clinical conditions with patients. This, and again, they show the reduction of symptoms with using this Lactobacillus rhamnosus. We have this other using probiotic intranasal nasal irrigations of probiotics. They found that the patients show are reduced in some symptoms, and they show a remission of 50% in the probiotic group and 38% in the placebo group. So we see that they're using different kind of strains. Here's another work with multiple strains with 800 people. Then they showed that the diarrhea was shorter in the people that used the treatment. And this work showed that also the nasal or fecal biomarkers show benefits in the supplementation of probiotics in elder people infected with SARS-CoV-2. What we know today about probiotics, that probiotics that dysbiosis can be corrected, and we can change this dysbiosis using the probiotics. So we have to encourage people to have more probiotics using what we don't have, especially treatment with a special strain that right now, but we can use different kinds of probiotics to correct dysbiosis and to correct the number of the microbiotas in the lung. What we know today is that the good microbial signature of patients is different for patients that have COVID and patients with have influenza and healthy people, that there's a therapeutic potential of good microbiome to reduce the symptoms and to prevent the development of COVID-19. But we still have to do more research. Let's talk about an area that has been not sufficiently considered, that is diet. I like this sentence of Dr. Calder that said that nutrients and bioactive compounds from one's diet play key roles in supporting the human immune system. These substrates act synergistically, and their joint action surpasses the effect of one single nutrient. And yeah, that plays an important role in shaping the composition of the good microbiota, thereby influencing the host good health status. This is a graph that shows that the two most dominant bacterial species in the human colon contribute significantly to butyrate production that helps the good microbiota in the gut. And that fiber also helps to increase the bifidobacterium and lactobacilliums and reduce the Clostridia. You can also note that higher bifidobacterial counts and higher total short-chain fatty acids are related to greater intake of plant-based nutrients such as vegetable protein and polysaccharides. The fermentation of soluble dietary fibers may, by certain bacterial species, have several beneficial metabolisms such as CSCFA, which serve to maintain colonic mucosal integrity and modulate the immune system. There is emerging evidence that shows that a healthy diet correlates with the risk and severity of COVID-19 illness. This is a very big study by Dr. Marino and colleagues. They collected data using a smartphone-based questionnaire, and they found that a dietary pattern characterized by healthy plant foods was associated with lower risk and lower severity of COVID-19. We have this other study by Kim and colleagues. They made this with healthcare workers from 6 different countries. They will also use the online questionnaire, and they found that people's reporting that they follow a plant-based diet or a pescatarian diet had lower odds of severe COVID-19 illness. And those also reporting following a low carbohydrate and low protein diets had higher odds of severe COVID-19 when compared with individuals who follow a plant-based diet. Me and my colleagues, we made an outpatient clinic trial during the COVID-19 pandemic. And what we made is patients were going to the clinic to ask for a PCR test. We asked them if they wanted to participate in our trial. So people that accepted, they went through a clinical questionnaire, and then a clinical questionnaire, food frequency questionnaire, and symptoms severity questionnaire, and then they were taken the PCR test. And this group of patients, we found 103 patients positive, 133 negative, and we found that a significant negative correlation between symptom severity and habitual frequency of food intake of legumes, grains, bread and cereal groups. I have to say that legumes is one of the main foods in Mexico. So it's an habitual food. What we know today, that there is still no strong evidence that herbs, spices, food ingredients, or dietary supplements prevent infection with SARS-CoV-2 or mitigate COVID-19 symptoms. We know that healthy eating habits, micronutrients, bioactive compounds, and probiotics are strategic for COVID-19 prevention, and that a diversified and balanced diet can contribute to the improvement of the immune response to viral infection with COVID-19. A combination of few common foods may be sufficient to prevent and even alleviate symptoms of patients. In case of COVID-19 patients that are hospitalized in critical condition or in ICU, nutritional support is vital. They need to make a nutritional assessment and implement a rapid and appropriate nutritional care. They have to make an increase in dietary proteins. They have to put entry fatty acids, selenium, zinc, vitamin D, and vitamin C, and the caloric value must be adjusted to patients' needs. As conclusions, more than 2 years have passed since the first case of COVID-19 contracted in Wuhan. Until sufficient vaccines are supplied, alternative therapeutic options through functional foods must be employed. Individuals with suboptimal intakes of a range of essential nutrients are likely to show suboptimal immune responses. There is a need for more studies to determine the possibility of functional foods and specific diet components, not only to prevent COVID-19, but to improve symptoms during illness. And novel technologies and delivery systems such as nanotechnologies can efficiently help in designing intelligent functional foods with the possibility of localized delivery in the good. Thank you very much.
Thank you, Dr. Salazar, for the great presentation. It really was very helpful to hear all this information.
Mm-hmm.
Yeah, So let's first see if anyone have a question. Please, anyone. I don't see in chat, so you can send question via the chat, or if someone need to speak, so we can unmute and also provide access to video. Okay, so until someone can think about questions, so I have some comments and questions also. Mm-hmm. So I'm very interested to have a to clarify about vitamin C and vitamin D especially. So far we were thinking that it is very clear that patient with COVID-19, they need vitamin C. And in many places it was mentioned that usually doctors using like 1,000 milligram vitamin C per day. Mm-hmm. Mm-hmm. But according to your presentation, even you say, yeah, it was it is helpful to have vitamin C, but still there is not a confirmation that vitamin C, especially exact amount, is confirmed for the patient. If you could answer on that, what's the reason? So we had so much investigations. Mm-hmm. And by the way, I see small clinical trials. That might be something.
Yes, also. Yes, there are some very little clinical trials, and there was when there's a review that shows that there was no significantly difference with compared from the controls to placebo. No, they show a little bit more good results when with people in the ICU, but people that with mild or with mild symptoms, there was not big difference.
Mm-hmm. Okay.
Good. So there was better results with the intravenous vitamin C.
Okay. And why you think intravenous it was more effective?
Mm-hmm. Well, I don't know. I really don't know. I really don't. I can say maybe because it's more controlled. The dose is more controlled.
Okay. Mm-hmm. So I remember several presentations from United States even before COVID, so that intravenous vitamin C, it is very helpful to fight with mm-hmm. some other diseases, even for cancer. And one reason is that they're using very high dosage of vitamin C. And I saw in your presentation also, it was I think they use much more. I don't remember actually exact amount. It was 5,000 or 50,000. Looked like it was a. Yeah. So the thing is that regular daily value should not exceed 2,000 milligram per day.
2,000 milligrams, yes.
Yes. Mm-hmm. So then certainly this could be after 2,000, could become a toxic. And usually doctors did not use those very high dosage. But in the case of severe condition, certainly that could be used. Of course, that should be under the FDA, whatever. Some authorities have to make a decision because using toxic dosage, so then you don't know what's going to happen later on. But at least, yes, in your presentation, I saw that they used 8-10 days. So they did not use lots of time.
Lots of time, no.
Yeah. So that's one thing I'm thinking. Secondly, vitamin C, we know that it's one of the best booster of immune system. So certainly vitamin C is very helpful, but we should have enough time. So it's not an overnight using vitamin C or any other stuff. It's not going to boost immune system, right? So we need more time. And all different changes in not only in whole body, but also in cell level. So it is taking a time up to 90 to 120 days. This is the reason that usually we asking or recommending that those usage of functional food should be long time, up to 90 to 120. And also looks Japanese government is very smart when they accepting or are not accepting functional food product. They considering clinical trials with 12 weeks, is 84 days. And also it's especially with you know, health product with vitamins, some other bioactive compounds, with natural way consuming, you know. So it is taking a more time rather than when we using a drug. So that meaning even they are very helpful, but we have to use in advance. So having a good immune system, so then body gonna fight with viruses much better rather than when it's severe stuff. Yeah, that's
yes, using
yeah.
it as a protection.
Yes, yes,
That's
protection
a
for
protection
prevention,
rather
yes.
than prevention. Than
Absolutely.
rather
And
than
I very like very much when you said for symptoms. And really, yes, one of the main point in our theory of functional food science is that at the end we have to think about not creating one ideal functional food product which is going to fight with whole disease. It is almost impossible. And that's the reason, actually, I think even drug did not have so much effectiveness, because we simply trying drug also at the end on the basis of some bioactive molecules, right? So we have to think about more how to manage different symptoms one by one might be, rather than whole disease simply using one bioactive compound. So same vitamin C, vitamin D, selenium, zinc. So they might be very important, but you know, to manage some symptoms, some certain symptoms, rather than whole disease. So that's something also we have to consider.
yes, yes, yes. That's very important because, well, I am a kidney or renal dietitian, and I see a lot of patients that start taking a lot of supplements and they have a acute kidney disease all of a sudden because this is good and this is good, and they take a lot of pills in order to maybe help with the disease, but they get worse.
Okay.
That's one of the things I look at that.
Yeah, so if anyone have a question, please let us know. If not, I can continue my question. Look like I have several other comments and questions. So one other thing I saw, vitamin D. So it was vitamin D. We know that most amount of vitamin D we can use, at least in United States, I know that it is 5,000 international units. But then we, in one place, I saw that someone was using 50,000. So at least, yes, we have to mention that this could become a toxic, especially vitamin D is, you know, usage high amount could be very toxic. Okay, so look like we have something in chat. If you are able to read, if not, let me see other questions. There is Kevin hand up.
Yeah, I
Okay.
just had a quick question.
Okay.
Yes.
Yeah, go ahead, Kevin.
Yeah, thank you for presenting. It was very interesting. So I have a question about the probiotic or the gut microbiome composition and how COVID impacts that. It looks like obviously COVID patients, when they're discharged, they have a different microbiome composition. Do you believe, based on the literature, that it's also like people with maybe an unhealthy gut microbiome composition are more susceptible to disease, or is it more the other way around that healthy individuals and they get infected and their gut is changed? Yeah.
Okay. No. Yes. The literal say that people with an unhealthy microbiome are most susceptible to catch COVID. This is there are a few very good works in, especially in people hospitalized people, that they look at the fecal microbiome and they found it. Yes, they are unhealthy. If they don't have a healthy gut, they're gonna catch COVID easier.
Okay, got it. Thank you.
Very good.
Mhm.
Let's see. Okay, so look like Kevin was no other people have a question in chat. Okay, so yeah, one other comment was about yeah, there's another question. Yes, so Delere, so yeah, go ahead.
Yeah, thank you. Yeah, my quick question is, I saw that you presented about neem, this neem leaves. So I don't know if you carried out research, but it's, I'm based here in Finland, and I have a brother in Ghana, and we were debating. He swear that he tends to use the neem leaves, steam it and inhale it, and it helps him. And of course, in Finland, there's no neem. So I was wondering, what is your view on this kind of thing?
Wow. Wow, that's just, well, neem actually they made a very good study. Is one of the controlled trials that they made, and they found that it's very useful for preventing COVID and for reducing symptoms.
Thank you.
Thank you. Okay. Any other questions? Yeah, and my final question gonna be about, so look like probiotics are very successful to use. So usually we do not, I mean, we heard that, yeah, that's useful, but with big clinical trials like you presented, 800 and more people, that's very interesting. And to me, especially, is very exciting that when they're using exact dosage of bacteria, positive bacteria, so then we can see effect. So that's one of the other main point of functional food science, that we have to find exact dosage of bioactive compound, because rather than simply using very different dosage, for example, you presented garlic also. Yes, we know that it has some anti-inflammatory whatever effect, but we have to find out exact dosage of bioactive compounds. So, and look like for a few places at least I saw you presented some positive bacterium, so they provide an effect. So then we have to especially focus on those stuff. So if you have any comment on that.
Yes, we have to especially found the exact dose, because people hear that helps you and they start getting extra from what they think they're going to make them feel better. So yes, we have to, and especially with herbs, we can teach people use herbs because they don't know how to use herbs in their daily food, and that will help also. Not they taking the supplements, but teaching them how to incorporate the herbs and garlic even in their foods. Mm-hmm.
Yeah, absolutely right. Yes, and yeah, we can see those stuff in actual research experiments. When we have amount of bioactive compound which works, we start in working. So then it works very good, and then higher dosage, they are not working at all. So that's very interesting, and we are publishing now. We are in the step of submitting one article on bioactive compound squalene, which is actually very interesting way, shows that yes, so usage of certain amount like 400, 600 milligrams, that's very effective for people who have certain chronic diseases. But as we using more time, so then look like they are not very, successful.
Mm-hmm.
Very interesting.
Yes, yes. We need more time and to do more studies.
Yeah. Okay, great. So then, if you don't have any other questions, I would like to again thank you, Dr. Salzar. It was a great presentation, and really we need to summarize what we get at this point because we are related to the COVID, and from our point of view, especially interested in functional food product bioactive compounds. So it was a excellent outcome what you also done in this review. So it was a great presentation. So thanks so much. So
Thank
later
you.
on we can speak with
Okay.
you and we can continue communication. Thank you and have a very nice day.
Thank you.